Good afternoon. This is Dr. Bill White again, and I'm going to talk to you again about using deciduous teeth. Seems like that they're the ones that are there, and on these two-phase cases, you have to go in quite early on these cases and do the orthodontic work, and so we use the two-phase cases is something that you need to learn how to do, and you just have to pick out the things that you would like to get done when it's real early. You go in quite early and do that, and that's what we did in this particular case here. It's a nice little girl, but she must have grown up in some place in West Texas where they had a tremendous amount of fluoride in the water, because she's had a lot of fluorosis of the teeth, which you'll see later on as we go through this. That stained them fairly bad, but not too bad. But she'll have to go in and have some facings put on her upper anterior teeth, I feel like, to really come out, because this stain is down in the enamel on them. Of course, they're resistant to decay, but that doesn't make them look a lot better. So anyway, let's get started on it. Here's a real neat, sweet little girl, and so we go in, and we're going to have to do something early on to really take care of this case. I'll show that more on the Panorex X-rays. We've got a whole series of these X-rays that we will go through in a few minutes with you. Let's look at the facial structures. Looks perfectly fine from here. I mean, it's the vertical height and everything. A lovely little girl. And here, when we look at the models, you can see some problems that she's got. This terrific diastema in the anterior part of the mouth, which we don't pay much attention to. We can push them together, and usually they just stay. You don't have to cut as many as we used to cut those things, but I found out you can just go ahead. Now, she's lost a deciduous cuspid on the right side. If you see right over here, there's a cuspid, deciduous cuspid gone, yet it's over on this side. So the teeth have moved in this direction. So we're going to need to kind of get things centered back up again before we go. So that'll be one of the things that we'll do in this first phase, and kind of coordinate the arches as we go. You can see on the right side we got almost an ideal class 1 occlusion back in here. The upper molars setting back in here real good. The lower molars out in front of it, not too well, a pretty good distance there. So this is more or less an ideal class 1. But now here's the lateral tooth. Has come back here next to the first deciduous molar, and we're going to need to move it back up here and move this over and get the midline lined up pretty good. And we'll try to do that by working off of these are deciduous teeth here, and these are deciduous teeth down here on the bottom. Now the ones up here are the ones that we use the most. Some of it we do down on the bottom. Now the bottom teeth have widened out more than the upper, and so there must be a little breathing problem where the tongue is staying down in the bottom arch and it's expanding the lower arch more than the upper arch. Now let's look at the other side of the mouth. Some of the same things. It's a good class 1 relation and everything, and the deciduous cuspid is here, so the lateral is further over. Now we're going to have to expand and move the right side of the mouth around toward the left to kind of line that up. We'll show some more things in the Panorex when we get Panorexes. We took a series of Panorexes on her. So here you can see we just pointed out that this had moved over in this direction. Here's this deciduous cuspid, and it's gone over here, and so everything kind of went in that direction. And so that kind of messes things up. You can see the center of the palette up here kind of angles off out to the left. Excuse me. But anyway, you're just going to take it. Now you can leave this alone, but it'll be a worse problem later down the line. So we go in early and start and do this first phase. And in the first phase, we're going to utilize the first 6-year molar and the 2, and sometimes we even get the cuspid involved in it. But if really don't have to do that, then we'll try to move this around to the side early on in the case. All right, here is, we've started the case now, and this is the right side of the mouth, and we've got an expanding arch wire back here on the 6-year molar. So this loop right here really would come way on out, and so we've condensed it and pushed it back in. Now we put spring, open coil spring in here, and we compressed it, and so we're pushing forward on these teeth. And we've already moved them together. You see the diastema, we didn't cut it, we just pushed it. At least I don't remember cutting it. It looks like it had a little bit of surgery done on it there. But we're shoving these centrals over, and here's the midline of the bottom, you see. So we're a lot closer, and we'll come back and catch this lateral and bring it in and make room for the permanent cuspid to erupt in on that side. Over here we put some so that we could expand it and get all the teeth further out over the lower teeth, and get the buccal teeth lapping over the lower teeth more than they were. So these are things that we're trying to do during this period of time. So anyway, now that we've got the permanent lateral coming in on the left side over here, and the right one is back in this area, so we're going to hook onto this before too long and push this in. And we're using these deciduous teeth, you know, as anchorage to push from, and they work great, and we use them right on through. And of course she's pretty young. I don't have the age on it right now, right there, but I'll show it. Here it is. This is 11 of 86, and that's just the number of the case up there. We're still quite a ways off from the midline, you see. It looked better a while ago. Now we've shortened this one, but we're continuing to add force over on this, on the right side of the mouth. So we're trying to center that. Now, if you needed to, you could bracket the bottom arch and use a midline elastic, but we're trying to add force over here and just stay in one arch and kind of shrink this one up. In fact, we'll try to push on this. We're trying to get the centrals out in front more than they are, and we'll see if we get that accomplished during this. So let's go through the this. You can see now we've got some pressure on this, pushing these teeth out and kind of pushing some over on this side. We're saving room for the permanent cuspid to come in that area right there. Now we've got to get this over so the permanent cuspid can get through there. We'll have to look at that on our Panorexes, which we took a whole group of. Now the bottom arch is lined up pretty good, and we've still got the 3 deciduous teeth down here that we just are holding the arch with, and we're not trying to do anything with them. When you look at the self on it, the upper teeth are just barely out over the lower teeth, so we'd like to get a little more overjet in this, and maybe a little more over bite closure there to finish that up. Now here we look at the first Panorex that we took in 7 of 86, you see right there, and you can see this lateral coming down right here. This is on the left side where we still have the deciduous tooth. This lateral ate part of the root away, you can see here. Now over here we have no deciduous tooth cuspid, so it's gone, and the lateral is in this place where it is, and these teeth have moved in this direction. So it's important to keep the teeth and try to keep it lined up and get everything in the midline straight early on. At least I like to do that. It's not absolutely necessary, but it is much better to get done early on in there. So now number 2, Panorex, you can see the cuspid coming in right here. This is the permanent cuspids coming down, so we're going to have to nudge this lateral over in this direction. Sometimes you have to bracket them early and put some tip in them and tip the tooth like that to get this cuspid coming down there. Then it will shove the tooth over. Do the same thing over on this side. It's coming right in on the developing root of that lateral. So we need to get these teeth out of the way of that cuspid and let it come on down. So you can follow on here and see what we accomplished. And we've got these deciduous teeth bracketed now, putting force on everything to expand the upper arch early on. All right. Here's number 3, and this is, and she's 7 and 10 months at this point, and this is 1987, 4 of 87, and we've got the laterals all bunched up together, laterals and centrals here in this point. Now you can put a reverse tip in these. You can put a little bend in the wire, kind of like that. You know, here, a little bit here, and kind of bunch the roots of these teeth together and make additional room and get your cuspids down, and then you can take it out and let the cuspids come on in to this space. So that's what we're doing. So we're letting the cuspids come in, and we've got this lined up just about the same on both sides. Not exactly, there's still more room over here. Now let's see what we have in Panorex number 4, and you can see we've got wisdom teeth developing at the age of 7 and 10 months. So she's nearly 8 years old, and the wisdom teeth have formed pretty good here. Now these are 12-year molars, and they're kind of late. And this is something up here, and I'm assuming it's upper wisdom teeth forming that early on. So let's go on now to Panorex number 4, and this is in 7 of 87, and she's 8 and 1 month old. and the cuspids still haven't started down, but one of them's coming in a little bit. You can see how it's kind of affecting the developing root of that lateral. That's what I don't like, to have them run into this. And this is a period where we just put a retainer on them and sit back and watch it, and then later on, when all these permanent teeth, but maybe one or two are coming in, we come in and do the second phase of it. So we haven't started the second phase yet, but we will as soon as these teeth are lost, and we'll have just maybe one or two of the deciduous second molars still left. We may start the second phase if we want to get in there a little early. She's 8 and 1 month old, and this is the 4th Panorex. Number 5, she's 9 and 3 months, and we're watching, and she's developing pretty good. And the cuspids now have pretty good space to come in. They've come past the developing roots of the lateral, and so we can just relax and let them come on in. Now the deciduous molars have lost most of their root structure, but there's 2 left over here and 2 left on this side. So I don't know whether it's age 9 and 3 months, whether we are ready to start or not. So let's see what number she's number 6 Panorex. All right, at this point, we will start, because we have one deciduous tooth up here with almost no root and one down here. So a lot of times we'll go ahead and start. And then a young lady that's 9 and 6 months, and she doesn't have any more jaw than that, it's very rare that they're going to grow much more jaw structure on there. And so the second, the wisdom teeth on the lower, just hardly have any chance to make it in. So I have recommended or told them that we wanted to get those out. We're in no mad rush to do it, but I marked them off on theirs. And so she's 9 years and 6 months old at this point. That's in 88. Okay, let's see if we do a 7th Panorex. We did, and here we have started the second phase and have almost finished it, but we still haven't taken these wisdom teeth out right here. We may have just been watching. We've developed complete upper ones, but we're going to leave them alone and let them push on it. But we'll remove the bottom ones in some of these where they have just a slight tendency toward class 3. We'll take out the bottom ones, but leave the upper wisdom teeth to push on that if we need them. So things are lined up pretty good. We open this a little bit more to bring that cuspid in. Of course, we'll close it when it gets in there. Now let's go to, and we did an 8 Panorex, and we still haven't taken those or had anybody take them out. So at this point, she's 11 years and 6 months, and there's just no chance that she's going to grow that much jaw to get that out in the open. You just have to come in something like that, and if it did, we have the teeth. So maybe we think she's going to do that, but here this is 1991, and we've got everything lined up and in center pretty good. Everything looks good. Now she's got fluorosis of the teeth, so she's got a tremendous amount of fluoride, yet she had a cavity right here in this tooth, I see, and maybe some decay in other places. looked like she moved right there or something happened in that. Now we have had the wisdom teeth out at this point on the bottom, but we left them on the top, and she's 12 and 6 months, and this is 12 of 91, so it's almost 92 here. So let's see, I don't think we have any other Panorex on it, and so I'm going to go back, and this is in the middle of the treatment there where we're waiting to start the second phase. We had a retainer in there holding that space open that we made earlier on in there. And so here it is in 1988, and you can see the fluorosis, the stain up here, and there's no way to get that out. That's sad. Other than just it's down in the enamel, and so a lot of people just put facings over them, and that's that point right there where we stopped. We still haven't got into it, and I'll speed through this. Beautiful young lady. That's 1988. Here she is a little older. This is 11 of 99, and she's got the braces on there, and we've lined everything up in the second phase at this point, and we're getting in another tooth or two, and we'll make room there for those teeth to come in. We got some cases, some pictures back, but back then, those days, you took them and you sent them in, and you had to take what you got when they came back. And this is 1989, almost 80, almost 90, and we're getting some teeth into the mouth. The bottom teeth are in at this point, 11 of 90 of 89, so almost 90. Here it is in 91. We're finishing it up, January of 91. And here she's a little older, January of 91, and developing very nicely, and very a pretty young lady. And here it is, we've all finished and everything, and the midline's right dead center. But she's got this fluorosis, and that's a problem. We don't have any good solution for it, and bleach doesn't do anything for it, you see. You can bleach it and maybe help a little bit on the outer edge, but this is down inside the enamel, and so you have to actually put facings on those, but she's got a beautiful set of teeth as far as the position of them and everything, but the fluorosis is a bad problem. Usually she grew up in a town or something where they had well water that had many times what you would put into the fluoride in other places. She probably ended up drinking that most all of her early life, and it just discolored the teeth. Now I've seen people with it a lot worse than this, but they have very few decayed problems with her, so she's lined up like that. And we came out with the teeth lined up good, and this is her older picture, and here she is to start. And so we go back to the first of this, and this is the end of it.